Um, well, let's get into it. I want to thank everyone for coming today. We have a wealth of information that is going to be given by the Ohio Treasurer, Mr. Robert Sprague. And I'd like to thank some of the organizations that are online today. Again, my name is Shalira Taylor. I am running for state representative in District 18, and I am here to bring information, bring resources to you guys. And this is what I'll be doing from here on out after elected. So just to give you a little taste of what we're doing. So again, I'd like to thank Serenity Health. That is the CEO, Sara Flemings. I'd like to thank Project White Butterfly. That's another Sara that's here too. I'd like to thank the Southeast Cleveland Resource Center, and that's Odetta Fields, who is the CEO there. You Can Escape the Box, which is ran by Ms. Tina Affum Barnes. And I believe we have either the vice president or the president of the Black Shield on as well. And the OCEC Foundation by Kudzai Maremachani. Sorry if I messed up the last name, but Maremachani. And then, so I'd like to thank the organizations for attending, and I'd like to thank every attendee for attending. Please take this information and give it back to your community. It's very important that we are sharing this kind of information. And again, I'd like to thank the Ohio Treasurer, Robert Sprague, for coming and sharing this great information with us. Please, Robert, he's gonna speak about some of the programs that are available. And I'd like to now introduce Mr. Ohio Treasurer Robert Sprague to talk about some of the programs.
Well, thanks.
I'm sorry.
Go ahead.
I'm sorry. So please hold your questions until the end of the presentation Mr. Sprague will be giving, and put all questions into the chat so we can look at them. Now, I'm sorry.
All right. Well, thank you, Shalira. I really appreciate the way you love your community. That's something that's struck me about you right away. All of the energy, all the interest that you have in serving your community and trying to make things better. And that's something that's part of our mission statement in the Treasurer's Office too. We wanted to do three things in the Treasurer's Office. We wanted to be a good steward of taxpayer dollars. That involves, managing our office, obviously, just as you would manage your state rep office. It obviously involves, we want to be wise investors in the future of our state. And sometimes that's an investment in a portfolio, and sometimes it's an investment in people. And the final thing is we want to be bold innovators for the people of the state of Ohio to help improve their lives and make a difference for families all across our state. And one of the things that Shalira and I had a chance to talk about briefly a couple weekends ago was our new ResultsOHIO program. And this is where we've introduced a new financial tool that actually would allow individuals in their own community to try to run a pilot project that solves problems at the local level. One of the issues, quite frankly, and look, I've seen all this firsthand, and Shalira, you're going to see it too when you get into the state rep seat, is people in Columbus a lot of times try to solve problems out of some sterile conference room, and they feel like they can just make decisions for everybody about what's best. And in a lot of cases, those solutions, lo and behold, they don't work because they're not grounded in reality. So our ResultsOHIO program allows people to start up pilot projects in their local community to try to solve problems. So here's what we do. We say, look, we go to the General Assembly, we'd work with Shalira, when she's state representative, and we'd say, look, we feel like this pilot project is worthy of funding. It's going to make a difference. for the people in this community. It might be a traveling dental clinic to give kids dental service in East Cleveland. It might be something to work on for employment in a local community, or to help people with recovery from drug addiction. Whatever the topic might be in the local community that's important to them. And we would sit down and we would get an appropriation from the General Assembly, and then we would develop metrics up front as to what success looks like. Like, how do we determine if the pilot project wins or not? I mean, what determines success? So we sit down and we define those things, and then we let the local community fund the project and run the project. And at the end of the project, we see if it was successful or not. And if it's successful, then the state pays for it. And whoever the local funder is, probably a philanthropic organization, like maybe the Cleveland Foundation or the Gun Foundation, they get their money back. And then they're able to pay that forward and put that money back into the community. And the benefit for the state is that, hey, now we have a program that works really well to address this particular issue. And we know, let's say, for instance, that we started out with a community project in Cleveland, and we know that that project works in Cleveland. Well, hey, why won't it work in Columbus? Why won't it work in Cincinnati or in Ottawa, Ohio, or wherever? So that's the value proposition. If I could maybe just take 60 more seconds and tell a story about our very first pilot project. So our first pilot project is to address a medical gap in some of the Appalachian counties in Ohio. And quite frankly, there's just not enough doctors. Where you are from up in Cleveland, it's like you have this competition for great hospitals. I mean, gee, do I go to Metro Health, which is fantastic? They've got all these great local services. Do I go to University Hospital? Do I go to Cleveland Clinic? I mean, it's only like the best in the world, right? I mean, so you have all these choices in Cleveland. People down in Perry County or Morgan County or Noble County, I mean, they may not even have access to a doctor or advanced medical care. And one of the doctors they don't have access to is optometrists. So the local community foundation down there, called the FAO, Foundation for Appalachia, Ohio, they said, look, we're going to try to see if we can do something to close this medical gap in these counties. And so they put up $1.3 million to run a mobile vision clinic. So I got to go down to Benton County and see this thing in action. So we pull up to the middle school. I hop out, my aides pull me inside. They're like, hey, Robert, you've got 5 kids. Let's see if maybe you can help this young lady that just got off the mobile vision clinic pick out a pair of glasses. I said, all right, yeah, I'm sure I can do this. She's probably, I don't know, 5th grade, maybe 10, 11. I was like, hey, how about the pink glasses, the purple glasses? This is probably what my daughter would pick out. This young lady wanted nothing to do with that. She wanted the bright blue glasses on the other end of the table with some black specks in them. And she put those things on. I'm holding up the mirror, and you can just see the smile just spread across her face from ear to ear. She loved the way she looked in these glasses. And I thought, hey, this is a super cool program. I'm glad I'm a part of this. And she walks off, and the optometrist grabs me by the sleeve, and he said, Robert, he said, I want you to know something. He said, I don't think this young lady's ever had an eye exam before in her life. I said, well, why do you say that? He said, because she can't see. All right, so if she would have gone to an optometrist, they would have had to have given her glasses after she walked in their office. So the reason she was getting eyeglasses that day was because we aligned these financial incentives. We didn't have a bunch of bureaucracy that was dictating a whole bunch of rules. It was a private foundation that said, hey, we're going to win. We're going to figure this out. We're going to figure out how to close this gap. They went out and they did it. And we don't know yet if it's completely successful because, I mean, look, we've got some pretty high metrics. They're going to reach a pretty high bar to prove that they're really getting this vision care to kids and it's really closing the gap. But it looks good so far. And if they win, then we're going to pay the $1.3 million back from the Ohio General Assembly in the budget of ResultsOHIO to pay for that pilot program. And then you know what we're going to do? We're going to talk to kids in Cleveland and see if we can't use the same concept to bridge that gap now in Cleveland. And then we're going to go to Columbus, and we're going to go to Toledo, and we're going to go to Northwest Ohio and the Flatlands. And so this is going to be something If we figure it out, and it proves to be successful, then we're going to go out and we're going to win in other places. So I'm really excited about this program. It's called Results Ohio in the Treasurer's Office.
Very, very good. Thank you so much for that. I had a question about Results Ohio. A lot of people ask this question. What kind of business structure is eligible for this? Do they have to be a 501c, or can they be a LLC, or what business structure is eligible for the reimbursement?
We're pretty agnostic over the business structure. They could be an LLC or a 501c3. What we really care about is, are they doing good in the community? Because if they're not doing good, the General Assembly, you're not going to give them an appropriation, right? No. So I think, that's the critical thing is the nature of the project, not the nature of the organization. But then the other thing I'll say about it is this is not some, get rich quick money scheme, for some private individual to come up and say, oh, well, I'm going to run this mobile clinic and we're going to get paid all this money if we're successful. We're going to make a huge profit. Well, that's not what this program is about. You're just going to get paid back, the cost of the project. There's not going to be a big profit incentive in there, but we're pretty agnostic as to the organizational structure of the entity.
Awesome. Very good. Thank you. I know that financial literacy is one of the important topics in your race, and same for me. I'm happy that the Senate just passed Senate Bill 1, which was done in July, to actually put financial literacy classes into high schools. So where are you at on this financial literacy? I can't hear you. Okay.
Go ahead.
Where are you at on the financial literacy, and what do you think about it?
Yeah, I'll tell you what. So one of the things we've done two things. Everybody says when you come into the office and you're the treasurer, they're like, wow, you got to have a financial literacy program. So we sat down and we started looking at these different financial literacy programs. And one of the things we realized was there's a lot of good work happening on the local level that just was never recognized. And so we said, well, the first thing we need to do is create a program that recognizes people at the local level for the good work that they're doing in our schools and in our communities on financial literacy. And so we created the Compass Awards, and we've been traveling around the state and handing those out. And we were just up in your area at a high school. I'm trying to think of the name of it. It's not coming to me right now. Alex, you know what the name of that high school was? Oh, here we go. James Ford Rhodes High School.
Rhodes, yes.
Yeah,
yes.
Rhodes. So we were up at Rhodes, and the teacher up there, she was amazing. And we got a chance to go and give her a Compass Award. And I'll tell you what really impressed me about this teacher was that, first of all, she came from a family of educators, which I loved. And secondly, when we walked in there, you could just feel how much in her heart she cared about all these students in her class. And as a result of them knowing how much she cared, they were completely and totally engaged with financial literacy. And normally financial literacy, you think of as being super boring. And the teacher kicked it off, and she said, look, I want you to know that how you manage your money really allows you to have independence in life. And all of a sudden, all these kids were super interested. And, so she started it off that way, how it was relevant to them. And she used a lot of the junior achievement curriculum. And so we also gave a Compass Award to junior achievement because that curriculum is great. It's so engaging for kids because it's interactive. It includes some people out in the community that come in and help mentor these young people. So I think it's a good program. We've given out these Compass Awards all over the state of Ohio, but Rhodes High School was amazing. Really great young people there. And I got walked out by a very intelligent young man. And I said, well, where are you headed? He said, look, I've got it all planned out. I'm going to this school next. I'm a senior. I'm going to become a nurse. He said, I'm going to be in the medical field. I know that that's my destiny. And he was telling me about all the things that he's going to do. Very impressive young man. I mean, he completely had it figured out. And, that's why we give out these Compass Awards, because, the teachers there that are helping these young people fulfill their destinies and gain the skills that they need. when they get out in the real world are the ones that we should recognize and uplift and make sure that we shine the spotlight on. So we were pleased to do that at Rhodes High School the other day.
Oh, I love it. I love it. It's very essential that we learn how to balance our funds. It was a great point that was brought up to me yesterday when it comes to social services, that if a child is already in the system and the parents can't keep their utilities on, that the child is taken away from them and they have to go through parenting classes, which we were like, they should go through financial classes because it's not a parenting issue, it's a financial issue.
That's a wealth issue, right? Yeah, that's not a parenting issue. Of course they want to have the utilities on. Of course they do.
Right. Right. So I think that's I think what you're doing is very great. And like I said, with the Senate bill pushing financial literacy in the high schools is a very great idea. And bringing it to families, you have a great program called Family Forward, right?
We do. Yeah. Wow. Man, you just lobbed up these softballs for me. I love this. You should definitely be state rep. You got a great way to elicit all this good information. But our new Family Forward program is supposed to help families out with the cost of adoption. And family. I didn't realize this. I actually had somebody come to me and say that it costs them between $40,000 to $50,000 to adopt a child through a private adoption agency, which I was blown away by.
That's
It's actually kind of incredible that it costs that much money. Anyways, and so I said, well, gee, I know the state has a tax credit, the feds have a tax credit, why isn't that sufficient? And he said, that sounds good, but the reality is, quite frankly, we had to put all this money up front out. I had to pay it out of my own pocket for the attorney, out of my own pocket for the adoption agency, out of my own pocket for the home visit, and all these other things. He said, and you don't get that tax credit until maybe a year or 2 years later. So he said, you guys really need to do something about this. And so one of the things that we did is we said, well, we can leverage our balance sheet. We have a $28 billion balance sheet in the treasurer's office. And we have this program called a linked deposit program that we can link a deposit at a local lending institution to try to help families with the cost of adoption. So if they took out a loan, we can lower the interest rate of that loan anywhere from 0.5% up to 3% for those families to hopefully help encourage adoption in our state. And we've got a couple of clients right now that are using it, and we're excited about the future of the program.
Oh, very good. Very good. So I believe we're getting questions now. If you're ready to answer some questions.
Absolutely.
Let's see. What is the total budget for Ohio, for Results Ohio? And if successful metrics are met, I guess, is there a zero reimbursement? Can the programs who are already, I guess, in operation and they have metrics show you now for reimbursement? How does that work? I guess they're asking, how do you get in? If they've been in business for 5 years already, can they show you that now and kind of being reimbursed for that, or is it moving forward?
Sure. Well, the way it works is, we're gonna have to have a pilot project, but it can be for something that's being done right now. So, if you say, look, we've got a great solution for XYZ issue in the community. All we have to do, though, we've got to take it to, Shalira, when you win your state rep race, we'll be showing up in your office, or you may sponsor the appropriation. Because we said, look, we don't want to just have a slush fund of money in the Results Ohio program. We wanted you and the General Assembly to be able to have appropriation authority over that money. Because if we think it's a good idea, we should be able to convince you and the project sponsor should be able to convince you as a state legislator that it's a great idea and an appropriate expenditure of state money. And so we set up the program so that they're all individual appropriations approved by the General Assembly. So there's no pot of money that's sitting out there. And The project theoretically could be any size, but I'll tell you the sweet spot, I think, for this kind of a program is a pilot project that's anywhere from $1 million to $2 million, and anywhere from 1 to 2 years. The General Assembly doesn't seem really thrilled about funding 5-year projects or $10 million programs. They'd like to do something that's smaller, see if it produces results, and then go from there. What was the other part of the question? I can't remember.
Let's see.
Did I cover all of it? Maybe I covered all of it.
I think so. Does the funding have to, I guess, come from local funding? I guess that's the question. Does it have to come from
so we could do
local?
The funding for the initial pilot project has to come from a local foundation. And this is actually one of the, double checks on our work, if you will, at the state level is, so many times when I was in the legislature, people would come forward, they'd have these kind of bright, shiny programs that they would hold out and they say, look, this is going to be really great. We'd end up funding it with a grant. And then, 3 years, nobody would ever hear back if that project worked or if it was viable on a go-forward basis. And so one of the things that we thought would be good would be to have some local philanthropic dollars involved, because those local philanthropies are the ones that are able to really judge on the ground whether or not a project is going to be successful and be able to take off. So it's required to have that private investment from a local philanthropy in order to be able to fund the initial pilot project, and then the state pays it or will pay for it if it proves to be successful.
Very good. So if anyone in the chat would or in the Zoom would like to ask the question personally to Sprague, please raise your hand and then I can unmute you. And that might be a little better. I'm gonna unmute Sarah S. because she asked the original question and I wanna make sure that it was covered for her. Or can I unmute Sarah S?
I got it.
Okay, you got it? Okay.
Yeah.
Okay.
Yeah, so that pretty much covered my questions. The other question that I had was, so if those results metrics are not completely met, but let's say you hit just below the numbers that you had wanted to hit, are you reimbursed possibly a percentage, or is it all in or all out?
Man, Sarah, what are you negotiating on behalf of Foundation for Appalachia, Ohio? It sounds just like the question they asked us.
I'm just a real small organization over here looking for ways to get money.
Hey, I mean, that's a super smart question, right? So, and that's really getting down in the weeds. At first, this whole thing, the way I talk about it, it seems so simple, right? But then once you start actually looking at the metrics and looking at the data, it becomes much more complex. But I'll tell you, we can set it up one of two ways. One is that it's kind of like a tachometer, the more success you have, the more money you get, that sort of thing, or the greater the degree of reimbursement for the pilot project. Or it could simply be more of a pass-fail. Look, if you can't reach this minimum level of success, there is no reimbursement. The bottom line is the answer is yes. Essentially, we can negotiate those terms on a one-off project basis and see what makes sense for that particular project. Some things are really difficult to, put a floor on in terms of minimum level of success. Other things are not.
Mm-hmm. Yeah, so just to describe a little about what my organization does. So Project White Butterfly seeks to support people with substance use disorder. We do a lot of community engagement and outreach. And one of the avenues that we take is to hang cards around the community that have numbers, treatments, and things like that. And when people call, we help connect them to the resources. Now, we spread a whole lot of these cards around the community, but we are not always on the receiving end of those phone calls So we don't know the number, the exact number of people who are finding our cards and utilizing the resources inside of them. It's a smaller cost-wise portion of our program, but that's one that I'm thinking about. You know, we put out 25,000 cards last year, and we don't have exact metrics on how many of those cards were found and how many people utilized those numbers and things.
Yeah, and you know, so if you're just to take an example, and I'm not saying this is what we would do with this particular project, but you know, you could set up a reimbursement based upon you know, the percentage of cards delivered out in the community, you know, versus the goal, and then the percentage of the goal that was met in terms of just the distribution of cards. That would be a fairly easy metric. If you wanted to, you know, drill down into it and say, look, the real purpose of this pilot project is to get somebody into treatment. Well, you know, now you got like data on, all right, how many calls came in from the cards, and are those people actually getting enrolled into treatment? You know, you could take it even further and say, all right, based upon the number of people that came into treatment, how many are in long-term recovery? And what's that percentage? And, you know, how did the, you know, what sort of effect did the cards have on people's ability to get into long-term treatment and long-term sobriety? So you can see where this whole thing gets pretty complex pretty quickly. It sounds so easy, you know, to determine a metric. But let me tell you this, Sarah, I'll say the other thing about this is that, you know, I think actually one of the values of this Results Ohio project is the delivery of that data metric that we were just talking about. You know, because once you begin to define success is hard to define in a lot of cases. And in government, we don't always take the opportunity to define success. You know, it requires effort and thought to define, all right, what is the success metric for something like that? And in some cases, that success metric is also a deliverable, a public policy deliverable, because somebody's put thought and effort into defining what is success for this particular problem. Maybe it's recovery, or maybe it's access to care. I don't know what it might be, but you know, what is the metric for that? How do we define that? And if we move this metric, do we know that, you know, it's making a difference for people with substance use disorders? So, you know, that in and of itself, in my belief, is a huge public policy win and value add, just defining those metrics and thinking about that data.
Awesome. Thank you. Thank you very much for that. My final question is, when can we process for that look like?
I couldn't hear everything that you said, Sarah. It's kind of like coming in and out. I think maybe you wanted to know, what was it? You asked a timing question. When can we apply? So we're looking at having another application period, more of a rolling application period, at the beginning of this upcoming calendar year, so January timeframe. And once Shalira is in the General Assembly, you can reach out to her office and work with her on it.
Okay, thank you so much for your time and your questions. We're kind of running short on our Zoom. I think we only have a few more minutes. We might have enough time for one more quick question. If someone had a quick question, let's see in the chat. Confirm the funding has to be local and not necessary for the foundation. My organization is funded by the Adams Board. Would it qualify for local? I guess they're asking if the funds are funded by the Adams Board, or if it's funded by probably another organization. Would that be considered local, or would they be able to get reimbursed?
Yeah, in the particular case of the Adams Board, I don't believe that qualifies, because some of the Adams Board money are state funds. And I think we require a private funder to start the pilot program. And the reason for that is simply because we really want it to be free of the bureaucracy and the rules that come with state government. We want it to be, you know, something that's totally locally community driven, and that people feel is going to have an impact.
Okay. Very good. Again, like I said, let's see, please summarize months from now. We'll remember things. Okay, so I guess it's months from now when we need to, I guess when anyone needs to ask questions, how can they, get information? Should they just come to me as the state rep, or is it a particular area in your office that handles these kind of questions for results?
Yeah, I think, we can do it either way. We want to work with our state representatives and our state senators and work through their offices and provide access to our programs through their office. But you can always contact the treasurer's office directly. And we have a great team, and we have Results Ohio is a part of our the programmatic offerings in our office. So just call the office, ask to get in touch with somebody, and don't worry, we'll hunt you down.
Okay. One last question.
Sure.
Is this something that someone can just apply for once a year, or is it something that they can apply for every year?
I think, is it an ongoing funding source?
Yes.
Not really. No, it's not built for that. It really is built for, trying new ideas. Like I thought, Sarah's idea, trying to hang up cards for people to help them get into treatment and into recovery. I mean, it's to try to do some innovative things. I mean, look, we're not, if money was the answer, we spent more money in terms of the state budget than at any other time in the history of our state. So just putting more money down the same pipe is the answer to our problems. We shouldn't have any problems by now. So it's not just, somebody said to me once, he said, Robert, he said, the issue here is not your problem. The issue here is really that you don't have a good solution, right? And so what we're trying to foster with this Results Ohio program is innovation, trying to develop new solutions that help solve these critical problems and do it at the community level and then have the state pay. So it's not meant to be an ongoing funding source. What it's meant to do is try to get a project off the ground, prove a new concept, and then you can go to the Adams board and say, look, the state paid me because our program was so successful and we're able to prove how it gets people into recovery. All right, and this is why you need to fund this program in the Cleveland area on an ongoing basis. And then you go to the Adams board and you have a rock to stand on to get that funding on a permanent basis. Shalira, I want to thank you so much for the time today.
Yes.
And you got one more question?
No, I just wanted to thank you so much for coming, and thank you for taking time out of your busy schedule to come and speak to us. And this is recorded, so I plan on sharing this with the rest of the community. You guys that are on right now, if you check back onto my website, which is ShaliraTaylor.com, and the next 72 hours, the Zoom should be up. So therefore, you can share this great information with the rest of the community. And again, Mr. Ohio Treasurer Robert Sprague, thank you so much. I think you're a great treasurer. She should be reelected again and again and again. And I thank you so much.